making sure we know each other's cultures and beliefs. In maternity, it's really important because everybody brings their kids up in different ways, and you need to make sure that you know how they respond, how they do things.
Everyone has different needs and everyone has the right to equal access of healthcare. You can't do a one-size-fits-all approach because it doesn't. And so, for example, if you've got someone coming up to the department who needs an interpreter, you've got to make that available to them because you can't have a chat with a doctor if you can't communicate very well.
If it's somebody's on a wheelchair, come down to their level. Just a simple, even if you say hello to an elderly person and ask them, are you lost, which way to go? That means a lot to them because sometimes they're wandering around the hospital not knowing where to go because this hospital is so big. So I imagine that person as my dad or my stepmom who would be totally lost if they came to the hospital.
For dementia patients, for example, they are scared, they are vulnerable, so I really think it's important to get down on their level and just talk to them. Someone towering over them is quite intimidating. Speaking really clearly, slowly, just saying short words to make sure that they can understand is really, really important.
We have a telephone interpreter service for foreign languages. There's also an interpreter service for British Sign Language. If I had someone coming in who was lip reading, I'll take off my mask and use a visor instead. We also have these things called reminder letters, so the nurse in the clinic will write down just the basic outline of what's being said and give it to the patient to take away with them, so that if someone is suffering from short-term memory loss, as soon as they leave the room they forget what's been said, they've got a little reminder to help them.
Positive relationship and friendship work it really helps with my work because we can help each other out, even in our social lives and communication as well.
In the day when we're at work, we do try to help each other as much as we can. If somebody's not feeling happy, sometimes we just take them into the staff room and have a little chat with them and try and make their day seem a lot easier for them.
Having a positive relationships in work, it actually filters onto the patient experience as well. It makes their stay a little bit easier in the ward. This filters down from, your executive nurses down to the healthcare assistants as well. Your kitchen staff, everyone has to get on well. I think the patients pick up on this as well.
I do think it's really important to have a positive relationship. It just helps the day go a bit better and just putting the trust in each other, making sure that you're going to become a really good team and strong.
Together,
We
thrive.
Împreună putem prospera.